Okay, so welcome back to this next video in which we're discussing the use of the glucocorticoids to treat asthma. Okay, so I'm sorry about the rather abrupt ending to the previous video. So, as I was saying, immunoglobulin molecules consist of a heavy chain and a light chain. In fact, two heavy chains and two light chains. Okay, and both the heavy chain and the light chain have this variable region which is specific to the B cell that you look at. Okay, so that will vary between all different B cells. Now, the constant regions then. The constant region of the light chain is set. There is only one constant region that you can ever use. So that's nice and simple. But the constant region of the heavy chain is slightly more complicated. There are many different constant regions that you can use, and these different constant regions lead to a different type of immunoglobulin being produced. Okay, so following the portion of the DNA which codes for the variable portion of the heavy chain, you then have all of these different exons which code for different heavy chains, and if you use the different exons, you'll end up with a slightly different heavy chain that can do a different thing. Now, what I was just saying before we abruptly ended the last video is that all of these exons here have, right at their end, a portion that can either be included or not included. And this portion is the portion that is responsible for implanting the immunoglobulin in the membrane. Okay, so it will add on a little bit onto the end of the heavy chain. Okay, so if we draw a heavy chain out, okay, so either you can just make the heavy chain, for instance, if we look at IgM, either you can just make the heavy chain up to this bit, and then not include this bit, or you can include that final purple bit which will add in this little bit down here, and what that purple bit will result in is the implantation of the heavy chain into the membrane, basically. So this is the portion that will result in the heavy chain being implanted into the membrane. Okay, so basically when you're making a heavy chain, firstly, you have your variable region, and then you have to decide which one of these exons you're going to use, basically. And once you've got your exon, you then have to decide whether you want to make a soluble form, in which case you'd stop before transcribing this final little bit, okay, or at least you splice it out. You splice it out in post-transcriptional modification. Okay, or you can use that bit to make the protein, and then you'll get the membrane-bound form of the immunoglobulin heavy chain. Okay, right. So, if you don't use the portion which lodges you in the membrane, you get the soluble form of the immunoglobulin, and by the way, Ig stands for immunoglobulin. Okay, and if you do leave that bit in, use that bit, then you get what's known as the membrane-bound immunoglobulin. So you'll get membrane-bound IgM. Right, so in naive B cells, what happens is you transcribe the variable portion, you then transcribe this intron here, you then transcribe the constant mu portion, okay, and usually you stop then. You stop here, somewhere here. Okay, that RNA goes to the ribosome, and then you create immunoglobulin heavy chains that have this variable region, and then they have constant mu region, and they also have this membrane spanning portion. Okay, you assemble two of these together, okay, like so. So they both have this membrane spanning portion down here, and then you add on two light chains, and then what you have is a membrane-bound immunoglobulin M. So this is the membrane-bound immunoglobulin M. When you have two heavy chains where you have used the C-mu constant region, that's known as an immunoglobulin M. And because it's got the membrane-binding portion, it's known as a membrane-bound immunoglobulin M. Okay, so the reason this is called the constant mu is because mu is the Greek equivalent of M. Okay, now, occasionally what can happen in these naive B cells is instead of finishing transcription here, you can actually go on further. You can transcribe all the way down to here. Then you'll get an mRNA which has both the variable region, and then both the constant mu region and also the constant delta region. Now you don't need to use both. It would be a disaster if you use both. So what will happen is when you are doing post-transcriptional modifications and you're removing these introns here, okay, from the mRNA, you'll also splice out this c-mu exon so that you join the variable region to the constant delta region, and then you'll translate that to get an immunoglobulin heavy chain. And then you can decide whether you want to use the membrane-bound portion or not. Okay, so let's say we do use the membrane-bound portion. We don't splice that out in the post-transcriptional modification. And then what will happen is you will get an immunoglobulin heavy chain that has this constant delta region in. And when you assemble two of these together with two light chains again, okay, then what you'll get is an immunoglobulin D molecule, okay, so this is IgD, and specifically because we've used the membrane-bound, because we've used the membrane-binding portion, it's known as membrane-bound immunoglobulin D, IgD. Okay, right, so naive B cells express both the IgM form and the IgD form, and they express the membrane-bound forms, and these are what are the B cell receptors. They are membrane-bound forms of IgM and membrane-bound forms of IgD. However, these naive B cells would never ever express the other types down here, okay? So, let's talk about the names of the other types. If you were to use these other constant regions, what types of immunoglobulin would you produce? So if you made an immunoglobulin out of two heavy chains which had the constant gamma free region, that would be what is known as an IgG. Okay, so G is the equivalent of gamma, and then free, IgG free. Okay, and again, you can either make soluble IgG free, or you can use this membrane-bound portion to make a membrane-bound IgG free. Okay, then it goes on. The constant gamma 1 will lead to IgG 1. Constant alpha 1 will lead to IgG alpha. Sorry, no, not IgG. IgA 1. Okay, so if you make an immunoglobulin where you use the constant alpha 1 portion, this constant alpha 1 exon to code for the constant region of the heavy chain, and then you make an immunoglobulin molecule out of two of these heavy chains along with two light chains, that will be an IgA1 molecule. Constant gamma 2 will give IgG2, constant gamma 4 will give IgG4, constant epsilon, okay, if you use constant epsilon, then you'll make an IgE molecule. So again, you make two heavy chains, both where they have the constant epsilon region, and then you bind them to two light chains, and that will make an IgE molecule. And again, you can choose whether you want the membrane-bound portion form or the soluble form. Okay, and finally, right at the end there's IgA2 as well. Okay, so naive B cells only express IgM and IgD. They never get to using these later ones down here. Okay, so what can happen, however, is that later on in the germinal center you can get a process known as class switching. Okay, so in these germinal center B cells, what can happen is that they can cut out portions of this gene, basically. So for instance, if you wanted to express IgE, which is going to be extremely important in asthma, what can happen in these germinal center B cells is that they can cut out, so let me show this happening, they can cut out all of this. Okay, so they can cut out the constant mu exon, the constant delta exon, the constant gamma 2 exon, the constant gamma 1 exon, the constant alpha 1 exon, the constant gamma 2 exon, all the way down to this constant gamma 4 exon. They can cut all of that chunk of DNA out of this immunoglobulin heavy chain and get rid of it. And then they'll join up this piece of DNA here to this piece of DNA here, and then you'll have the variable region with an exon in between it and a constant epsilon at the end. So let me show this happening. Okay, right, so here is the variable portion. Okay, and now you've got a new exon that's made from half of this exon and half of this exon over here. a new intron, which is made up of half of this intron and half of this intron here, and then followed by the constant epsilon exon, and then of course the constant alpha 2 exon will still be there. Okay, so here is constant alpha 2. Right, so that process is known as class switching recombination. Okay, class switching recombination, because we are recombining the DNA in order to switch classes of antibody that we're going to produce. Okay, so what can trigger this class switching in the germinal center B cells? Well, specifically this type of class switching that I've drawn here. And I want to stress that this is not a normal type of class switching. Often you will class switch so that you produce IgG molecules, okay? So you might cut out the constant mu, the constant delta here, just those two, and then bring this constant gamma free right up to the variable region, okay? This is the class switching that's going to end up producing IgE. Now, because now these germinal center B cells which have undergone this class switching, they will transcribe the variable region, they'll transcribe this exon, they'll transcribe this constant epsilon region, they'll stop transcribing here, they'll cut out the intron here, and then they will bind together the variable region and the constant epsilon region in the mRNA, and that will then go and be translated into an immunoglobulin heavy chain, which will have the variable region followed by the constant epsilon region. Combine two of those together with two light chains, and you have an IgE molecule. And the type we're going to be specifically interested in is the soluble type, where you don't use this final portion here, so that will be spliced out as well. Okay, so what can trigger this form of class switching that I've shown here, i.e. chopping out this entire lump here so that the constant epsilon region is opposed to the variable exon up here? Okay, well, there are two cytokines that are very good at triggering germinal B cells to class switch so that they will now produce IgE immunoglobulins, okay, and those are interleukin 4 and interleukin 13. Okay, so interleukin 4 and interleukin 13 will drive these germinal center B cells to class switch so that they now express IgE antibodies. Then, when these germinal B cells that have class switched to IgE become plasmablasts, these plasmablasts will also have no choice but to produce IgE because the DNA has been changed. They've got rid of the constant mu region. They have no chance of producing immunoglobulin M. They haven't got that DNA anymore. They can only produce the variable, they can only produce IgE basically. Alternatively, they could potentially produce the IgA2, but it's more likely that they're going to produce IgE. Okay, so the plasmablast will then produce IgE, and then the plasma cells that this plasmablast produces, they will also then produce IgE as well. Okay, so through this method you can cause the plasma cells to end up producing this immunoglobulin E molecule. Okay, so I just want to discuss one more little thing, which is that this takes time basically. Class switching is something that requires the germinal center B cell to have been in the B cell follicle for a very, very long time. Okay, now in the germinal center, what's going to happen is that some germinal center B cells will differentiate into plasmablasts very, very quickly. Okay, and these plasmablasts that you are forming will have to produce IgM and IgD because you just simply haven't had the time to class switch. So you have to have been in the germinal center for a long time, and I'm sorry, I think I said B cell follicle earlier. They have to have been in the germinal center for a long time to undergo class switching. So some of these germinal center B cells will differentiate into plasmablasts very quickly, and therefore the germinal center B cells won't have undergone class switching by then. Okay, so these plasmablasts will have the full intact immunoglobulin heavy chain gene here, and therefore will end up producing either IgM or IgD, just like the naive B cells did. Okay, they'll produce the soluble version, okay, and their plasma cells will then produce the soluble version and tip it out into the blood. But it won't be IgE, basically. So initially, some of these plasmablasts will be coming off very early, and they'll be producing IgM and IgD. Also, you have to think about the fact that if they've come off the germinal centre very quickly, then they haven't gone through many rounds of affinity maturation. So the affinity of their antibodies that they're producing for binding to the allergen is going to be quite low, basically. So the initial plasma cells that are produced from the germinal centre are going to produce quite low affinity antibodies, and also they're going to produce IgM or IgD antibodies rather than the other forms, okay? Whereas plasma cells which come off later, so germinal centre B cells which come off much later and then differentiate into plasmablasts and then plasma cells, these will have gone through more cycles of affinity maturation, okay? So the affinity of their variable region for binding to the antigen is going to be much higher, okay? And in addition, they will have gone through class switching, so they can produce differing types of antibody, okay? So it's going to be these later plasma cells that are coming off the germinal centre which are going to be producing IgE, because those are the ones which have undergone the class switching. Okay, so in this allergic reaction to the allergen, what will happen under our primary exposure is we're going to start producing plasma cells which are going to produce very high affinity immunoglobulin E molecules against that allergen. Okay, now this overall response that we have now discussed has a very grandiose name. It is what's known as a type 1 hypersensitivity reaction. Okay, so when you launch a humoral adaptive immune response against a protein which does not deserve the humoral adaptive immune response being initiated against it, and that humoral adaptive immune response results in the production of IgE antibodies against that protein, it is what is known as a type 1 hypersensitivity reaction. Hypersensitivity refers to the fact that the immune system is reacting to something that really is innocuous and does not deserve being having an immune response initiated against it. Okay, so it's overly sensitive, basically. The type 1 means that we have initiated a humoral adaptive immune response against this protein, and secondly, that the immunoglobulin we're producing is immunoglobulin E. Okay, now what's going to happen? Why does this immunoglobulin E now lead to asthma? Well, let's go on. Okay, so let me get another piece of paper. So, what's going to happen is these plasma cells are going to take up residence within the bone marrow. So they'll first be tipped out of the lymph nodes into the blood, and then they'll take up residence within the bone marrow. And they will start churning out this IgE. Okay, and they live for some time. They don't live forever. They will die within a few weeks to months, okay, but they will churn out a lot of IgE against this allergen in that time. Okay, now what's going to happen to this IgE? Well, it will go into the blood, and then it will disseminate all around the body. So it will go into all of your tissues of your body. Okay, and the tissue that we're specifically interested in is the bronchi. Okay, so some of it will go in through these blood vessels that are in the lamina propria. Okay, so remember we have blood vessels within the lamina propria. Some of it will come out of these blood vessels into the lamina propria, and it's going to be mounted on these mast cells. So these mast cells are going to now be very important. Okay, so let's discuss mast cells. So mast cells are a type of sentinel cell, okay? So their job is to sit in a tissue and keep an eye out for pathogens, basically. They are a watch cell. They are watching all the time and looking out for pathogens, okay? And if they see any signs of a pathogen, they will release all sorts of alarm signals that will trigger an inflammatory response, okay, to try and eliminate the pathogen. Now, on the surface of mast cells, what you have is a receptor known as the Fc epsilon R1. Okay, so this means the fragment crystallizable epsilon, so it refers to the constant region of an IgE molecule. So remember, immunoglobulin molecules, their constant regions, or their FC regions, were dependent upon which constant region you used from the immunoglobulin heavy chain gene, basically. Okay, and remember, we have produced IgE, so the constant region of our immunoglobulin heavy chains down here is going to be the constant epsilon region. So that's what this means. It means the fragment crystallizable that corresponds to the constant epsilon exon. Okay, and then it's the receptor 1. So this is the fragment crystallizable of, let's put IgE, and it's the receptor 1. Okay, so what can happen is these constant regions of the immunoglobulin E molecules combined to the Fc epsilon R1 receptor on the surface of these mast cells. Now, what's the significance of that? Well, it's going to arm these mast cells against the allergen, because remember, what is the job of these mast cells? The job of the mast cells is to look out for pathogens. Now, one of the ways they do this is by having this Fc epsilon R1 receptor on their surface. And then what can happen is you can load IgE molecules that you have made onto this Fc epsilon R1 receptor. And this IgE molecule will then bind to, the idea is it will bind to antigens associated with pathogens. So if a pathogen comes in, it'll produce antigens, bind to this IgE on the Fc epsilon R1, activate the Fc epsilon R1, and then activate the mast cell. Okay, so the idea is that we are priming these mast cells to detect a pathogen. We're making them better at their job by giving them a new way of detecting pathogens. The problem is that this IgE molecule is not against a pathogen, antigen. Instead, it's against a allergen. It's against a antigen which was not harmful in the slightest. So we are now going to arm these mast cells to detect this allergen. Okay, and they are going to initiate a very dangerous inflammatory response against something that is not harmful in the slightest. Okay, so this is not going to be good. So in the next video, we'll see what happens when the secondary exposure to the allergen occurs.